chronic pain? Why are you on several pain medications? And how can you learn to do your own pain management? Okay. First of all, what happens when you injure a nerve is just like any other part of your body. You know, like when you get a sunburn, it takes a few hours for the redness to show, a few more hours for the blisters to come up, right? Same thing with nerves. It take a while for the nerves to really show how much they're damaged, and then they start trying to heal. Well, unfortunately, what happens to nerve endings in a damaged area is that they don't heal the way they were before they were injured. I mean, we know that about the rest of our bodies too. Break a leg, it doesn't heal quite the same way as before. You have a scar from a burn, a scar from a surgical cut or a laceration or something. There's always something a little bit different. Well, unfortunately, what happens with the nerve is that it actually puts out more areas at the end that sense touch, okay, or pain or vibration or whatever. That's one of the things that causes if you have a nerve injury, and now sometimes some of you may have where you just barely touch the surface and it burns, and that's what happens with you with your RSD. Okay, that's because there's more nerve endings in the area, and they're much more sensitive, and it picks up something that would not normally be picked up as pain by your body, but the signals that go to your brain are saying pain. Not only that, but because of the chemicals that they let out, particularly when they're stimulated, they can actually irritate some of the other nerve endings around them, so it actually increases the size of the where the signals are coming from. Areas of the spinal cord actually change. And then the brain areas that take these signals and decide what they are when the signals get up there and interpret it can also change. What you end up then with is a neuropathy. Neuro meaning nerve, and pathy meaning abnormality or bad, or depending on who you read. So you end up with a neuropathic pain syndrome. Or simply, it's just chronic pain. Chronic pain means long-term pain. So what amount of pain relief is reasonable to expect? You want all of your pain to be gone? I know you all did it. I know you want it all gone. Okay, but that's not the real world, is it? Unfortunately. Okay. Well, the thing is that each person responds differently to drugs. There's no one set of drugs that I can say, these are the ones that you need to be on. This is exactly the right cocktail for you. Okay. Every person responds a little bit differently to the drugs or combinations of drugs. Each class or family of drugs only works in about a third to half of the people that take it. Or it only works optimally in about a third to half of the people that take it. So that means you may have to shop around for drugs, switch around things. Each type or class of pain treatment lessens the pain only about 30%. Only about a third. Okay? And if you've got severe pain, that means you've still got some pain left over. Now, if you just stub your toe in the morning, you can probably take an aspirin or an Advil or a Tylenol or whatever, and you can get on with the rest of the day. This really wasn't that severe a pain to start with. But if you're starting out at a 9, it's not going to relieve it very much. There's several different pain classes or classifications or families of pain meds. Acetaminophen, which is Tylenol, most of you go, that's not our thing. Tylenol is a very effective drug, and the older the person gets, the more effective it can be, because then you don't have all the side effects that many of the other drugs have, and the allergies and the